Assalamu alaikum. We are starting with the communication case. Mrs. Smith or Mrs. Smith. Tanya Smith, aged 24 years, was admitted to the hospital on Friday afternoon with a suspected pulmonary embolism. She was started on therapeutic enoxaparin and was told she would have a CT scan of her chest. It's now Sunday evening, and Miss Smith feels that nothing has been done since she came into the hospital. Furthermore, she has been moved a total of 4 times since she was admitted to the emergency and is presently a medical outlier on the general surgical ward. She is extremely upset about the lack of progress and the lack of communication since her admission and demands to speak to the doctor on call, the candidate, about this. Her vital observations are stable and her symptoms have almost completely resolved. Your task to find out the reason for Ms. Smith's concerns and address them in a suitable manner. Let's start after sharing the timer. Ready, Dr. Abdul Manan?
Yes.
Okay, Dr. Sarah?
Yes.
Yeah, here you go.
Hello. Hello there.
Hi.
My name is Dr. Ahmed, one of the treating doctor in the clinic today. May I confirm that you are Mrs. Smither, 24 years old?
Yes, doctor.
Miss Smither, we are here today to discuss some issues related to your health. Is it okay with you?
Yes, it means I want to talk to you. It means that I asked the nurse to ask one doctor to come to talk to me.
We are here for you to help you in any regard, Mrs. Smith. Mrs. Smith.
Okay.
Just to be on the same page, can you please tell me how much you know about your health status?
Yes, I was sleeping restless for 3 days, and I was having chest pain in my right side, and also having, a cough. And I've noticed some blood also in my cough. So I came I came on Friday evening in the hospital, and the doctor for me some tests, and they did for me a heart racing, and they gave me medication, and they told me they will give me antibiotic for infection. Want to do a scan on my
Sorry again.
the doctor told me that I'm having chest infection, give me antibiotic, and told me they want to scan on my chest in order to exclude the blood. Until now, this didn't happen. So I'm on Friday, Saturday, and now today, Sunday, and no one did for me the scan.
Thank you for sharing this with me, Mrs. Smither. And I'm sorry about what you have been through. And just let me to explain what happened in this situation. And first of all, how do you feel now, Mrs. Smither?
I'm feeling better, doctor, and if you don't want to do anything for me, I think it's time to go home.
Well, I highly appreciate your concern, Mrs. Smither. Regarding the first concern, the treating doctor, they give you the medicine and treatment the best of interest of you, and this can be and I as you mentioned that now your condition improved, so this is the best treatment in interest of you. And regarding your second concern, Mrs. Smith, as you know, today is a Sunday evening, but the already CT scan is scheduled, and they will do it as soon as possible. And regarding your second concern, if you want to go home, if you are going, this for time now, it's important to do this scanning of your chest, because we need to confirm our diagnosis, and also we to prevent any further complications might be happen. I hope you understand this point, Mrs. Smith.
So you're saying that this is something concerning and they should do for me the scan. So when they will do the scan, it's now 2 days and no one did for me the scan. And my grandmother was having a blood clot and she died from that. So I know what is meant by blood clot in the lung. And you are saying now that this is important to do the scan, and there is a delay of doing for me the scan.
First of all, please accept my deepest condolence in your grandmother loss. And regarding this, yes, this we are concerning, but we are in the same time we already started the treatment of blood clots, which is called Inaxaplin. This is the blood thinning medication. So I want to assure you, at the meantime, you're already in the best treatment and already you covering this treatment for blood clots. And I want to assure you this, and based on the improvement in your health condition, that means this is the best treatment for your condition. And regarding the clots and recurrence of the clots, while you are on this blood thinning medication, the chance of getting these clots is very rare, Mrs. Smith. I hope you understand this point.
Okay, but you didn't answer my question. Why the scan is not done for me till now?
I highly appreciate the concern, Mrs. Smith. As today is Sunday, sometimes let me contact with radiology, scanning office and scanning department, and let me to know why it's not done. But I want to assure you, I will follow up this request by myself and will be done as possible as we can. I hope you understand this point, Ms. Smith.
Okay.
Well, do you have any concern or you want anything you want me to explain more?
Yes, the other things, I'm very upset about what happening. In the last, I'm only admitted for these 2 days, and they transferred me from the emergency to the clinical assessment unit, and then they took me to the post-take admission unit, and finally in the surgical ward now. And when they transfer me from the surgical ward, they asked me to go in the middle of the night, which is not acceptable. I was sleeping. So I don't know what's happening exactly. Why they are transferring me all this time from these wards and not accepting the patient dignity and the patient he's sleeping. So I think this also is not acceptable.
I'm sorry about what you. I highly appreciate your concern, Mrs. Smith, and I am sorry what happened to you. And I will assure you, incident report will be raised for this, and we will see what happened exactly. At the same time, regarding this issue, mainly sometimes it occurs because of bed availability, because sometimes we don't have enough beds. But I want to assure you that we already have we already know about your condition, and your condition explained well for the staff, and now you are receiving the best treatment the best treatment for your condition.
Okay. Okay. So the other things I want to say, can you check if they won't do for me the scan? I want to go home. Okay. Because
Okay, well,
I didn't sleep yesterday, and I think if nothing is done for me in the hospital, and I'm only taking antibiotics, so I can take this antibiotic at home, and I want to go home.
well, Mrs. Smith, let me to explain some point or to clarify the situation here. Actually, the medicine that you are taking is, you mean the blood thinning medicine is not antibiotic. It's called blood thinning medicine. This medicine is taken for this medicine given for your case because to remove these clots in the main blood channel in your lungs. Am I clear so far?
Yes, but they are giving me also an antibiotic. They told me you have chest infection.
Sorry?
The doctor told me at the beginning that I have chest infection, and they gave me antibiotic, but they need to exclude the blood clot. Okay.
Uh-huh.
Which in combination with it,
Okay. You can.
s-
I'm not quite. I don't know what you are giving me. You might be right. Okay.
um, okay, Mrs. Smith, can let me to explain to you. Actually, your condition here, it's not it's not a kind of infection in your chest. We are suspected might be a clot in the main canal of your lungs. So it's important to stay at the hospital at this time and to follow up closely and monitoring you closely, and this until we do this chest scanning.
Okay.
Okay. Do you have any other concern?
No, I don't have any other concern.
Okay. What do you for living?
I'm housewife.
Okay. Do you smoke?
No.
Okay. This let me appraise you because this is good for health, Mrs. Messer.
Okay, time is up.
Okay.
Well done, Dr. Abdelman. Although you didn't convince here, but let's see the comment from Dr. Sarah, then I will comment.
I'm not seeing in the scenario that the patient starting antibiotic, but when they're explaining the case, they said that
Yes.
it's chest infection. So I think there's something wrong in the scenario itself, because it's
Yes,
written.
because I got confused. There is
Yeah,
nothing like that in the
that's
scenario.
why but when they are explaining the scenario, they're saying
Yeah.
that it's better to stay to finish your interview antibiotic and to do the scan. But when you told me this, I read the scenario now. I see no antibiotic and no chest infection. So
Okay, let's clarify it, Dr. Sarah. If the scenario like this in the paper and the patient or the surrogate say, they told me that I have infection, and the scenario is PE or suspected PE, you can't do both together, all the scenario. So they suspected infection and they started antibiotics, and they suspected PE for which they started empirical therapeutic
yes,
anticoagulant till the CT will be done, right?
so
you
if
can
the patient is saying I'm taking antibiotic, we assume that, and we'll tell her till you will finish the antibiotic, right?
yes,
Even
and until also to confirm the PE, you have to be admitted, and this is the task to confirm the PE together along with the antibiotic. It can be like this. I guess you read the scenario well, but no controversy in the scenario. There is PE suspicious. However, they told her there is chest infection and they started both. We are doing that in most of cases, right?
But I think, Dr.
You have
Basim, I think it should be written clearly in the scenario.
yes.
She started to be treated as a chest infection, and now she is waiting to confirm her diagnosis, either infection or PE. But since there is nothing like that in the scenario, I got confused. I don't know. I didn't know if this even if
All right, but I'm asking, when the patient saying I was having a cough with them and they told me chest infection, but they need to exclude PE. So I don't know at this situation we can agree with the patient. Yes, you are receiving
yes.
Okay, so this is
You have to believe and trust the patient
and trust the scenario at the same time.
as well as the scenario, exactly. So you can drive both together. Yes, you have chest infection as the doctor told you, but we have to confirm there is no PE by doing the CT chest or the scan for your chest. Until that time, you have to receive the antibiotics and the anticoagulant. Since the PE rolled out, we can stop the anticoagulant and we'll treat the chest infection only. Sometimes we face this problem, right?
Yeah. Okay.
So the take-home message from this scenario, always trust the scenario, and yes, believe the patient and trust the patient as well. Not only the scenario, not only the patient. Sometimes the patient or the surrogate will tell you something which is not written but you have to believe it.
Ah,
Because you are talking to the real story. You are listening to the real story. Once
okay.
she mentions something, you have to believe it and you have to trust. The same idea when he told you, doctor, no one informed me about the side effect of the medication. You will say, no, you are a liar. No, you are believing him and you are apologizing and so on. So let's hear the comments. Let's hear the comment, Dr. Sarah, about the performance in general. Then I will comment.
انا عندي محاضره امشي ما تفتح علي.
Can you, okay, so Dr. Ahmed, you did it well, but I think at the beginning when
Dr. Abdelmenem.
Abdelmenem, because he said Ahmed, okay, Abdelmenem.
Yeah. Always the third name you are mentioning in the scenario, your third name, not the first, not the second. This is the rule also.
Yes, I know. Okay, Dr. Abdelmenem, at the beginning, by introducing yourself to the patient, you said I'm doctor in the clinic, but you in written scenario you are the doctor.
Yes. The word.
Okay,
Yes.
so you say I'm a doctor on call today, and when you said I want to discuss with you, no, you have been asked to the patient want to talk to you, so I'm coming to you because the nurse has informed me that you want to see one of the doctors, so I'm here to help you. So you make it like this, okay? Because it's not in the scenario the patient coming with complaints. The patient already admitted, and she asked to talk to the doctor. So you will understand this from the scenario. So your introduction will be like this. Okay, because I told you no, I want to talk to you. That's why. Okay, and you did it well, but I think for this patient, what I'm telling you, why no one give me no one see me over the weekend and the CT not them. So you can explain for her briefly. You was admitted on Friday, and now and for the over the weekend we had different system. There is only one doctor on call in the ward, and he's usually seeing the critical ill patient and the newly admitted patient. And I'm not saying, and on the other side, the nursing team are checking your vitals every 6 hours. And if any patient has any concern or any symptoms, he is informing the nurse, and the nurse will inform us, will come immediately to see the patient. So I'm not quite sure did anyone explain for you that on Friday that this is the system over the weekend. So and that the good thing that your condition is improving on antibiotic. You already told her with a good way that we already started for you a blood thinner for the clot, and you can say it also the same way with the the scan. I think also the radiology team will have less staff over the weekend, so they might prioritize the critical ill patient. But I will call them and see when you will be your scan, and I will come back to you. But I just want to reassure you that we are monitoring you closely. And you know that you are improving. If anything happened, the nurse will inform us. And your condition is improving on the antibiotic. It means it's most likely an antibiotic, but we need to exclude the blood clot. That's why I advise you to wait. Maybe till we do the scan, and you might we might change your antibiotic from intravenous to oral. If she's saying that I'm taking intravenous antibiotic, okay. And then when I'm saying you, I want to go home, ask her why, okay. So this patient, she want to go home because she has a 3 years old child, and her husband is working, and her child now with her cousin, which is not usually taking care of him, okay. So when I'm asking you ask me why, I will tell you this reason. So you will tell me I'm really appreciate that. But can you can you ask someone can help you to take care of your child, another family member or another friend, because your health is the most important. I think your health is most important even to your son. We need to exclude the pulmonary embolism as you blood clot, as you said. It's a critical thing. So we want you to go home to your child in good health. So you can address it like this when she's saying, any patient saying, I want to go home, ask her why, or I want to do anything, ask why. So she will tell you something. Okay. Otherwise, you did well. But the only issue is that you will explain for her the system over and the other things when she's saying that they are transferring me from where to what. So you tell her, I really apologize because it's not acceptable. This is a mistake. not the mistake by delaying the CT scan. The CT scan can be delayed as long as not urgent. Many patients will request for him them a CT scan, but when we called the radiologist, they said this is not urgent, we have an urgent case, so she will wait as long as the patient is stable. So it's not mean that we requested for her the scan, she should do it. They prioritize the patient. Okay, so this is not a mistake, but the mistake which has happened, I think it's not acceptable to transfer the patient in the middle of the night unless there is a clinical concern or clinical need to do that. If the patient is ill, they want to transfer him to side room and has infection, or is this patient he's critically ill, they need to transfer him to the ITU. So no need to transfer the patient in the middle of the night.
Can you
Unless,
please repeat this point again? The point she transferred 4 times.
yes,
So what is the ideal response in this situation?
for these patients, they can transfer the patient from many wards, no problem. As you said, there is a problem in the availability of the bed, and the bed manager is trying to find beds. That's why it can be acceptable to be transferred. But because you have been transferred in the middle of the night, this is not acceptable. Okay, we are not transferring patient in the middle of the night unless there is a clinical indication for that. So I really apologize for that, and I will ask you will say only apologize, and I will discuss this with the nurse and the bed manager in order to ensure that this won't happen to you again. You only in the middle of the night. Okay. Because the patient are sleeping, and will come to wake the sleep patient from the middle of the night, and there is no clinical indication the patient is not severely ill or that he doesn't have infection to be transferred. So this is unethical. So you can say it's not a medical error, but it's not, you will, when she's saying in the middle of the night, so it's not acceptable. So you'll tell her, we'll discuss it with no need for incidents report or anything. Apologize, say only apologize for that. I know that it's unacceptable unless usually you are expecting that the patient to be transferred from ward to ward because there is bed shortage and the bed manager try to sort the bed issues. But as you said, it's not acceptable to be transferred.
Do I need to raise an incident report?
No, you will discuss it with the nurse, and if she said I want to complain, okay, you can complain. But I don't know. You will ask the nurse. I don't know. You might make it as a DATX, but I think in this scenario, the most things that to explain for her why the CT is delayed. So I'm not quite sure that the scenario can يعني هيستحمل medical error also. I think it could be a minor medical error if she patient said, you will tell her what you will do. I apologize for that. We'll discuss it with the bed manager and head of the nurse to ensure this won't happen again. Okay. So if she tells you, no, I want to do an incident, I want to complain, so you can understand that medical error, apologize again, and help her to fill a complaint. I'm thinking that, but Dr. Bassem also can.
Yes. Yeah, I good comment, Dr. Sarah. I will start from the beginning, but about this as an error, it's not. It seems not a clear error. Yeah, maybe there is some reasons we don't know, and we didn't realize what happened there. So what we can do, just to say sorry and feel sorry for him. I'm sorry about your suffer, your less sleep, and be sure that this is not our habit. We are not usually shifting patient from here to there unless there is clinical reason or something need, as you said. But to make incident report, you don't know what happened to be as a clear error. So the big thing is to be sorry for her, and if you want to be for one time, apologize for the feeling of upset, like she is transfer here and there. I'm apologizing on behalf of the team, on behalf of the team, but let me know what happened there with the head supervisor or the nurse supervisor and the mid manager, and we will update you about the reason or about this investigation. This is related or regarding this point, transferring the patient many times. It's not accepted thing. Yes, you can say, yeah, it's not accepted. We are not usually doing that unless there is some reason or indication. We are sorry for that. But today's insert report, No, I don't think it's something a major error. I mean, this is regarding the transfer from here and there. The second point is the delay of the CT. Also, you can be sorry for that. If you are not aware about the policy of weekend and the priority of the patient and the CTs, you can say, I don't know also what happened there. Usually we are doing it as soon as possible and as long as the patient is stable. However, let me confirm from the scan doctor or the scan department what happened there. Maybe there is other patient prioritized to do the CT for them before you. But to be delayed for 3 days, this is also something not accepted. So again, you can be sorry for that. I'm sorry for this delay. Let me contact the scan doctor or scan department. And the good thing here, Dr. Abdominem, you said by yourself, I will follow the request myself. I will go to the doctor, the imaging doctor, and I will try to make it as soon as possible, as much as I can. This is good solution. However, you don't know the rules of weekend. Yeah, you can say it. Maybe you don't know, Dr. Sarah. This is my point. Yes, it's accepted thing to say, yeah, over weekend we are not doing unless there is indication.
No, there
But
is
also,
are working, but they prioritize the patient.
yes,
And I say,
yes, but for 3 days,
yes, accepted. Any investigation is accepted to be delayed unless it is an urgent and the patient is compromised. If we are in the A&E and we have patient that he need to do a CT scan now, and we are not doing the CT as as any country you request it, and no, you will call the radiology. I have a patient that I need to do for him an urgent CT scan, so he will ask you what is the problem with this patient, and he will try to convince him. You will try to convince him, and then he will say, what is your concern? I'm concerned that this patient might have PE now. Okay, so I let him come now. So this is
yes,
the way of doing. And if it's not an urgent, so the patient can stay 1 or 2 or 3 days, even over the weekend, weekdays. It's not a mistake, this one. Only unless there is the urgent, or even, the urgent referral for the cancer 2 weeks. This a mistake, not acceptable. But the
yes,
patient is stable, because this patient is hemodynamically stable, and the nurse team in every ward, they are checking the full vitals every 6 hours. And if the patient has any concern, one patient say, I'm having chest pain, so she will call there is a bleep, so they bring the doctor and call, they bleep him, so the doctor will come to see this patient and to address the concern. So this patient is not complaining, and her vital is stable for 6 hours for 2 days over the weekend. So over the weekend, sometimes we are not saying all the patients. So I think we can say this, over the weekend there is only one doctor on call. So he prioritized the patient by seeing the critical ill and the newly admitted. So we can,
yeah, I agree.
yes,
Yeah, I agree with you, Dr. Sarah.
yes,
But my point, I'm saying, if you don't know the role of
yes,
the
yes,
weekends, you can say like this. Yeah, we are usually doing the CT as much as we can or as soon as we can. However, maybe there is some overwhelmed work in the radiology area or in the scan area. That's why they delayed you or they postpone you. Don't say delayed, to postpone you for the routine days. However, we started for you the best interest medication, which is blood thinner, to prevent, not to, you said to, I think, to treat or to remove the clot. No, it's not to remove, it's to prevent the further clot. Because how to remove, either by thrombectomy or by thrombolytic therapy. So the point here is to prevent further blood clots inside the blood channel of the lungs. Apart from that, the medication given to you in the best interest, the antibiotics as well in the best interest for your condition. And
yes,
we are following you. Yeah, the vital signs, everything is stable. So we are taking care of you. No worry about that.
yes. And
Okay,
you are,
but in general, yes, go ahead, Dr. Sir.
you can say, because yes, it might not be acceptable. So you can say most likely they prioritize the critical ill and newly admitted patient.
Yes.
And the other things, the nurse are following you. We cannot say that we won't only see, we won't see you. I think also this is not a good ethically. So you should see all the patient. So if we can make it in a diplomatic way. If we prioritize the critically ill and the newly admitted, but I want to reassure you that the nursing are following your vitals every 6 hours,
Yes.
and your condition is improving. So we have good handover, and also we got the handover over the weekend from the team working on Friday, and we have been handed over that your condition is stable and starting to improve. We can
Yeah.
like this, not say we won't see you. You are right. You'll be in the middle.
Yes, I agree. The good thing also in this scenario, let me say in general, Dr. Abdulmenem drive the scenario well, as the scenario is not clear between infection or PE, but he drive it well. So from the all directions, he covered the scenario well. Apology on time when she transferred from here to there, and the introduction and everything. But try to take history for the why she want to go home. Yes, sometimes this is main concern. I want to go home for some reason. Which are my kids, my cat, my whatever. You have to address and you have to solve. Sorry for that. We can call some friend or your relatives, your family members. They can help you or whatever. So you can ask why you want. Whenever, let's take this role also as take home message. Whenever there is patient want to leave the hospital against medical advice, try to address, maybe this is the case task, the scenario task is to address why she want or he want to leave the hospital before finishing the medication or the management or the treatment. It might be something concerning that you can solve, and once you solve, you address first and you solve, you will get the full mark. If you let him or you didn't convince or you didn't screen or you didn't reach the reason why she want to leave and you didn't convince, you might fail. So try to convince after addressing the reason of leaving the hospital against medical advice. Anyway, this is the patient right. Sometimes, yes, he insists, okay, you can sign DAMA at the end. Sometimes they are bringing such scenarios. As a DAMA, after taking some of the doses, unless something serious like a homeless patient or TB patient, open TB, and he's risky to transfer the infection to others. So you have to convince, or sometimes the suicidal patient, you have to detain if she has any suicidal thoughts. This is the in general, I mean. But in general, Dr. Abdulmenem did great. Apart
Yeah.
from I am the doctor in the clinic, yes, but you are the doctor in the ward. Try to read every word in the scenario, your task, your position, the patient name, the age, and again the task. It will be written up and it will be written down. Okay. Any other comment, Dr. Sarah, before
No,
moving
no.
to? Okay. Any other comment from others? Yes. Good. Thank you, Dr. Abdulmenem, for cooperation.
Okay, we
Any
can.
other? Yes. You read the scenario?
Yes, I read it.
Okay, I will read it for the
Okay.
record only. Then we can start straight away.
Okay.
Mrs. Kazi, a 52 years woman with past history of hypertension. She was brought to the hospital with seizure and loss of consciousness. CT brain confirmed a massive ischemic stroke with hemorrhagic transformation. From time she was intubated, she hasn't responded or triggered the ventilator for almost 48 hours. Despite sedation being withheld, the apnea test confirmed brainstem death and was signed by two consultants, senior ICU physician. Her son is aware of his mother's major stroke, but doesn't know how about her brain stem death. He doesn't know about her brain stem death. He is waiting outside. Your task is to discuss with the son about his mother's brain stem death and organ donation. It's clear task. Good scenario. Okay, are you ready, Dr. Sarah?
Hopefully.
Let's
Okay. Hello.
Dr.
Hello,
Abdelmanan?
doctor.
Yes.
Hello.
Yes. We can start. Hello, I'm Dr. Mahmoud, one of the doctor here in the hospital. Are you the next of kin of Mrs. Ghazi?
Yes.
And can you confirm her age for me?
Hello.
Can you confirm her age, your mother's age?
Yes. She is 52 years old.
Okay, I'm coming to you now to update you about your mother condition. But first of all, can you tell me and address all your concern? But can you tell me more how much do you know about your mother condition in order to be on the same page?
Yes, doctor. The doctor just informed me that my mother had some sort of stroke, and also recently she also told me that she has some sort of bleeding inside of her brain, and also I know that she is attached to this artificial lung, I think.
Yes.
And yes, I'm hoping that she gets soon better soon, doctor.
Yes, I appreciate all your concern. That's right. But just want to ask you, is anyone of your family here in the hospital want him to attend with you our conversation?
No, doctor, I don't think my mother needs anyone to know about her health too.
Okay, I really appreciate that. But can I know how I can call you?
Yes, Ahmed.
Okay, Ahmed. Ahmed, unfortunately, you are right that your mother has a hemorrhage in her brain, a massive bleeding in her brain, and we give her some medication to make her sleep and put her on a breathing machine. But unfortunately, Ahmed, things didn't go as we expect.
What do you mean, doctor? What happened?
I'm really sorry to tell you that your mother brain is dead now. I'm sorry about that.
What?
Yes.
What are you sure, doctor? Because doctor, I'm seeing her breathing. I see her heart is pumping. I see the monitor, doctor.
I'm really sorry about how are you feeling, and I can see where you're coming from. I'm here to support you, and let me explain for you what exactly is happening with your mother. Okay, so we when we give her the sedation, when we give her the medication to make her sleep on the breathing machine, she started not responding. So despite we have been withdrawn all the medications that make her sleep, she's not responding. And in this situation, we have two consultants that examined her and confirmed what we call brain stem death, which means that the brain is dead now. I'm really sorry about that. And you are saying she's breathing. You can see her breathing now, and she look well, but because she's on the breathing machine, if you remove this machine, your mother will not breathe.
Hello.
Yes.
Yes. The surrogate is crying now.
Can I? Do you want me to bring for you water?
No, thank you, doctor.
Okay,
So.
yes, you can have. I can give you some tissue.
No, okay, thank you. Go on, doctor.
So I'm sorry about that, to tell you about all this bad news, and I can see that I give you a lot of bad news today.
Thank you, doctor.
With me?
Yes.
Okay. So so that's why they have confirmed that. So I know that it's not the right time to discuss it with you, but I just want to ask you if you give us consent, if your mother wish or you wish to for your mother to donate her organ.
What do you mean, doctor?
Yes, because in such situation, when the patient is dying, it means that he's already clinically dead. Some of the organs still we can, while the patient is on ventilation, we can, if the patient was giving a permission to give his to donate his organs, and the family are happy with that and want that, so we can proceed with this. I know that it's not the time, but I want.
Doctor, can you tell me about this organ donation?
Yes, the organ donation, it means that we can take some organs from your mother and give it to some patients that in critically, and this will save the life for other patients.
Doctor, are you trying to steal my mother's organ?
I'm really sorry that you feel it that way, but some people are happy to have to do the organ donation to make other people live. If you don't want to do that, you have the right, okay? But I'm proposing this for you because I think we need to if you want to that your mother can donate her organs, so we will keep her on the breathing machine until we will do that. If not, we will disconnect your mother from the breathing machine because, as I told you, she's.
Okay, doctor, so how are you going to do this organ donation?
So I think if you are happy with that, I can call the transplant team. They have some procedures that they will do, and they will try to take this organ in a proper way without causing disfigurement of the body.
Mhm.
And then but after taking your permission.
Okay, doctor, I'm really afraid that this will cause a lot of harm, I mean pain to my mother. But doctor, I want to just to ask you, if this your mother, are you going to do the same, doctor?
This is a difficult question. I'm not in the same situation as you, but some patients are happy to help other patients. I know this is too much to take today, especially when I give you all this bad news. But some people they are happy to make other patients that are critical ill. Some of them they might have a liver failure. Their liver have failed, so your mother can give them their liver and they can live a good life after that. And some people not accepting that, so it's your right also to accept or refuse that.
Okay, doctor. So I think my mother is a kind of person, she loves to help other. So I think I don't have any problem to do this organ donation. But if you can explain me more, and I'm afraid that she will not have this pain. And I'm afraid that if you agree to do so we will not delay the funeral, doctor.
So
2 minutes left.
Okay, so let me explain it further to you, and you can take your time to take the decision. Your mother already, she has brain death. She's not feeling anything. Okay, brain stem death. It means that already the patient is clinically dead, so your mother won't feel any pain. And the other things, when we have the expert transplant team, they can take the organs by doing a small cut in the skin, taking the organ and try to stitch the skin in a proper and non-apparent way, and we will try to make this quickly. And they might do some tests to check for infection or some procedure. I'm not quite sure about that because I'm not from the same position as them, so they can take these organs, and we'll try not to delay the final procedure.
Okay, thank you, doctor. I think you satisfied me. I don't have any other questions.
Okay, and at the end, I'm really sorry about happening to your mother. And if you need any help, I can guide you. We have the bereavement teams that can help you and support you with that. And really, my condolences.
Okay, thank you, doctor.
Thank you. Okay.
Any other
Yeah, this is
question?
very
I'm really tired of these scenarios, breaking bad news, talking about this.
Yes, it's very
And
difficult.
with no
I
sympathy.
think it's very difficult task. His mother is
Yes.
gonna and ask about
I,
donation. I don't know what's happening.
I think it's Abir's diet, right? I don't remember the
Yes.
center, but Abir's diet.
Yes.
You did it very well.
Okay, we can start with the comment. Yes, yes, well done.
Yes. Yes, well done in sympathize. The most important thing that you did it in sympathize and empathize way. I think you did even this sequence. You delivered the breaking bad news, death breaking news, and then you switched to the matter of organ donation. Yeah, you did everything great, but you have two concerns. The first one, do you want to steal her organ? And this question you can just address it. No, this our team is licensed team, and they are professional and work under the supervision of the government or the health authority. So just to address his concern. The other one, the question that if this is your mother, you're going to do the same. Actually, this is the justice. This is how to raise the justice, whatever the situation. So it's pregnant, if it, organ donation, or for example, in withdrawal of medication or DNR, whatever, almost always surrogate raises the justice issue by this way. So is this your relative, or is this your mother, or is this your father? In this situation, you're going to do the same or no? No, yes, we are here. We follow strict policy in our hospital. We treat all the patients, regardless their age, regardless their ethnicity, regarding their relative. We do the same and treat them the same. Otherwise, I don't have any comment. You did it very well.
But sorry, thank you. But sorry, what he's asking me if you are on the same situation. So
Yes,
it means that
you have to accept.
I will say if I will in this situation, I will accept. I think I couldn't say any
Yes,
personal or any patient will ask me about anything personal or anything regarding my feeling or my decision. It's not acceptable. That's why I make it in general. I don't know.
No, this is the way how to raise the justice in the exam, because there is no exam question in this new format, right?
So I will tell him we are treating every patient equally, and that
Yes.
I will be the same as you or what? How I say?
Yes, we
Yes.
treat all the patients regardless of their age, regarding this ethnicity or their relative. We do the same for all patients.
Okay. Okay.
But
I
otherwise,
I will add. Yeah, well done. Thank you, Dr. Amna. Any other comments?
no.
Okay, in order to convince this patient, let me add comment regarding this point. Firstly, what do you think if you want to convince her, what shall you say to her, Dr. Sarah?
I will say to her that you by organ donation you are saving other people's life.
Yes, so
Yes.
if your mother will in the same situation, will you accept this? What do you think?
For me, I won't accept this because this is
No, no. Leave the real life. I mean, in the concept of exam,
you know here in the UK anyone will die, they will take.
Yes, he is candidate for.
If the family didn't say I don't want to take any organs, they are taking.
They will take. Yeah,
if
they will take by
they
default.
say I don't want you to take the organs. Okay.
Yes, but by default they are candidate for organ donation.
Yes.
The brain death patient.
Yes.
So in the view of exam, you have to say, this is my opinion. Yes, if I am in your place and my mother like this, I would like, and my mother soul would like to help other patient to survive and not to suffer. So
but not quite sure of saying that because I'm trying to convince the patient. I will explain for him what is the importance of this and keep him take the decision, because I think I'm forcing him.
No, not force. By the way, we are not forcing. It's also, this is your wish, whatever you want or no. You are saying that whatever the situation also. But it's one point to convince, okay? Make it as a weapon. I'm trying to convince you, however, this is your right. As you said at the end, anyway, this is your right, either to accept or to refuse. I can't force you on that. Okay,
So
but
I'm the
for
advice
for
situation, and it's you at the end to decide, like this, right?
yes, I will say yes. I would like, even you didn't say yes by yourself. You can say it in another diplomatic way. Let's repeat it. I would like to help others as well as my mom or my mom's soul to help others to survive and not to suffer more. I heard about these patients; they are suffering a lot, and my mom also, whenever she's alive, she helped a lot of people, and she would like to help them.
Okay.
So it's not clear yes, and also it's not clear no. But you are trying to convince the idea of organ donation.
There,
And
we are not, we couldn't talk about our personal life in. So I will skip.
yes, yeah, okay. Don't say yes. I will accept. Don't say yes clearly. You can say, I would like to help others. You didn't say yes. I would like also my mom to help others, and even in her situation while she's sick and critically ill. However, other people will get benefit from her organs. This is good thing for her, and the reward will be for her.
Yes.
You got it, yeah. So you can say like that if you want to be diplomatic, not clearly answering yes. This is regarding the point of will you accept if you are in my situation. This is, yeah. The second thing, if you are happy to do or you happy, don't say if you are happy. No one will be happy to give or to take the organs from his mother.
Yeah.
So the best say the best word to say, you can say, yeah, I'm fine with that. Are you fine with that? Or he is fine
Yeah.
with that, or she is fine with that. Okay,
Yes.
but not happy. No one never ever will be happy. His mother will be cut and had the disfigurement, or she will take the organs from her. This is
Can
the most, yeah. Okay.
Yes, can you explain the brain cell death? Why the organs are suitable for donation?
No. Don't go deep through this. This is not our job at all. Suitable or not, this is the process of the organ donation team, and it's not your job, not my job, not even the consultant in the ICU. There is team for that, which is called organ donation team. Okay, don't go through this. But for the disfigurement, yes, they will they will concern about that. Doctor, will you disfigure my mother body? No, I'm reassuring you, they are professional. As you said, they are professional in that, and they are cutting very small cuts, and even they return the bodies as before. No one will never notice any cut in her skin or in her body. Okay.
Yes.
This is the second concern. The concern of brain death. You are trying to avoid jargon, but sometimes you are saying it like,
Yes.
yeah, mechanical ventilation. Then you are saying breathing machine. So try to practice more and to train your tongue to avoid the jargon.
Yes.
You are
One
talking
more
to,
point.
yes.
Yes, she mentioned that if you are not agree to do organ donation, we will continue for I think ventilator, right? Yeah,
Withdrawal.
she mentioned that we will continue for ventilation. No need to mention this point because most of the time they stop
Yes.
ventilation. Yes, no
They
need to
are
because
withdrawing.
I
Yes.
read a lot of
Scenario,
concern.
I read this scenario. It's written that in the explanation of the scenario, they will keep her on the ventilation
No.
be in good position when they are on ventilation. The organ will be in يعني حالتهم.
It's not written in the scenario. Don't mention it. This will make a lot of trouble for you in the exam.
Yes.
Brain dead patient.
Because even the surrogate is medical, so will raise a lot of concern, and he will delay your wasting your time.
Yes, you are right. You are right.
Yeah. Okay, let's start from the beginning. The good thing here also, you invited someone to attend the meeting, which is a horrible meeting for her. He will receive a lot of bad news, the organ donation, and so the best thing is to call someone, as you did, to invite or to call someone of your family to attend this moment.
Dr. Basim insists point. She's
Yes.
talking to the next for the matter of confidentiality.
No more. She's brain dead. No more confidentiality for her. She will die.
Okay.
Or she's already dead.
Yes.
So no more confidentiality. After seconds, you will break her bad
Yes,
news for death. Yeah.
yes. For the HIV patient, we are writing in the death certificate HIV because the patient already died, so there's no confidentiality.
Yeah, no more. This is the only situation you can invite for someone to attend. Breaking bad news for progressive disease to the patient himself, so you can invite his wife, or if she is, you can invite her husband, your
Oh.
brother or sister in some progressive disease. And in this situation, breaking bad news for dead or comatose patient, lost capacity for the patient. So you can invite someone to help him or to help her to absorb all this, because it's really makes sense, and also it will help a lot whenever you are sitting to two members of family, like two brothers or sister and brother, or rather than talking to one family member, he will be in shock, he might collapse. But whenever he has a company, they can hug each other, they can support each other. You know, it's even in real life, it's emotionally support, very effective.
Yes.
Better to call for two members or more if you can, because
And
everyone will know, nothing
yes.
to be hide. Yes.
And the other things they told us in the course, if we are breaking bad news for one patient from cancer, you can say at the beginning, I will ask one of the specialist nurse. She can
Mhm.
attend with us this meeting. So
Mhm.
she will provide you with all the support, and she will give you her contact number. If you, I know that you might have some questions to ask later,
Mhm.
so you can
Yeah.
her directly, or if she didn't reply, you can leave a voice message and then she will reply to you. So if the patient breaking bad news for the patient as cancer for the mesothelioma for one patient, so you can
Mhm.
beginning say I will call the specialist nurse to attend our conversation and explain why she will attend,
Mhm.
because she will give him all the support. He can call her to ask about any question later. So this
Yes.
the support for the patient himself when you are breaking bad news about the patient himself, cancer or any breaking bad news.
Yes, you're right. Even the information and some care she can teach him
Yes, this
how to take care of. Yes,
they
you're right.
will come to attend the conversation.
Yeah. Okay. After the introduction, what's the information and what you know about your mother condition and the expectation. Try to ask for the expectation. It will help you to break the bad news. Yes, till now she's in coma, or she's in. You said hemorrhage, by the way. So hemorrhage also one of the jargon. But you corrected immediately
Yes.
by saying massive bleeding. Yes, it's bleeding, not a hemorrhage. Okay. Then you can ask for the expectation. What's your expectation?
What you
Yeah, what you
I
expect
will say,
from this meeting, or about any idea what's ongoing. She will tell you, yeah, I feel my mother will be okay. She will say, no, my mother is not okay. So you can at least give her initial message that there is something concerning. Okay, then the warning shot, you did it great. I have bad news today, or the news is, or the things not going as we hope, or something, or what you said. I think you said the things not dealing as
yes,
we think. Or, yeah.
as we,
Anyway, yeah. Any word that it's like warning for the patient, something is shocking coming after this sentence. I have something concerning for you. Something, as you said, the things are always not as we hope.
Mm.
Anyway, by your way, it's okay.
Mm.
Then you have to give some seconds silent, and to break the bad news. I'm sorry to say, or I'm afraid to say, your mother is brain dead, or in deep coma due to brain dead. Try to make it like this. Okay. What the meaning of brain dead? You can stop here. Your mother is brain dead, or in coma and severe coma, and we are saying that it's brain dead. Then another golden silence.
Mm.
Do you know about the brain death, or if you ever hear ever about the brain death, then you can explain what the brain death meaning. Okay. He will, of course, he will react. Yes, as he said, I'm crying, or she's crying. You can offer her tissue, and you can offer also water. Then you can proceed for the explanation what the meaning of brain death, and we did exam, and we are confirming the diagnosis by test called apnea test, and this test done for the brain death patient. Whenever they are not breathing, they are not responding at all, they are dependent totally on machines, and if we stop this machine, unfortunately they might die. Okay. Then the concern will come. Why, doctor, what happened, or whatever? After you finish the concern of brain death, the other task for organ donation, as you said. But try to prepare the things by saying, if your mother wishing to help people while she's alive, did she was or did she help people in charity, or did she help people by money or whatever? Just to give the idea or the good benefit from donation. Your mother, if alive, she would help these people. There are a lot of people suffering from certain disease, and they need some help from others. What you mean, doctor? Yes, I mean they might need some organs from those who have brain dead, like in your mother condition. And this is the other information I want to deliver to you today. I'm sorry to share this with you. The team following your mother decided to, after your consent, of course, to get some organs from your mother to those people to help them in their life. They will get too much benefit, and also your mother will get too much reward after doing this. Why, as Dr. Adman said, are you stealing? No, it's not the matter here. I'm sorry if you feel like this.
You are right, but I think don't say your mother will get award, because if they don't know that they will have any award, they're not believing in that. So don't say these things. I think no, don't say she will have the reward and these things.
Why? Because other people will live by her organs. So
No,
why
they
not?
know. They know that even when the patient is dying, so he's not feeling, he's not getting any reward.
Mhm.
So don't talk. I think better not to say this thing.
Okay.
If
But
she's
for
alive, I think if she's alive, she's happy to help other people.
yes,
So
yes.
what do you think we can? There's many people suffering with many organ failure, so we can help by
Yeah.
uh,
Okay, I agree, but try to say it before we will take your mother organs. You
Hmm.
got it? Try
Yes.
to prepare for that. Yes, if
Yes.
your mother is alive, she would help these people, or she's helping others. Any charity work she's doing like
Yes.
this, to prepare only. Okay, because the coming is difficult to deliver without preparing. So you
Yes.
have to start like this. This is my opinion also.
You are right. No, this
Yeah.
is
Okay. I think the other concern we addressed it earlier for the organ donation, for the cuts, for disfigurement.
And the other things I want to add, the time of brain death is the time of death of the patient will be the time of the brain stem death, not when we disconnect her from the machine. In the
No,
date,
no, after the clinical death, not brain death.
no,
The declared, you mean declare?
yes, when you write in the death certificate, you write the time of the brain death, because this is
No.
the death of the patient. This is the thing that I
No, we are here not doing like that. We are writing after clinical death. Stop the heart, I mean, not
don't
the brain. No,
read.
no.
No,
No.
I think at the time of the brain death.
Yes,
Brain death?
yes, yes,
So you will put the date of brain death, or
yes.
Yes,
after?
yes.
When the two consultant has evaluated and they confirmed the brain stem death, this is the time of death. This I
Okay,
read
this is in Europe? You mean in worldwide or in Europe? Because in Saudi Arabia they are not
No,
doing that anyway.
scenario here, and this is scenario here. But I don't know in the practice.
No. For us, clinical death. I mean, circulatory
No, but I
death,
think
not.
okay, we can write this, but I think if brain stem death is confirmed, it means this is the time of death. That's why they taking two consultants to confirm the brain death. But any death, any doctor in the world, any even junior doctor, They can ask me in the word, Sarah, come to confirm the death of this patient. I can confirm the death and write the death certificate. I write the patient, I saw this patient at this time. He's not moving and I write all the comments of the death certificate. But for the brain death, if two consultants are doing the brain cell death, I think this is the time of death.
Anyway, we will not go through
What
this
is
during the scenario.
Yes, so we won't
Yes.
say, but I'm saying as a general.
Yeah. Okay. In general, also, whenever the family or the son will ask you what time I can take my mother body, so we will try to do it as soon as possible after the team will finish the process. We will provide you with the death certificate,
Yes.
and you can proceed for the funeral. Yes.
Ah.
And again, be sorry for the condolences that as Dr. Abdulmenem did.
Yes.
Okay, or as you said, but also in your scenario, yes, I remember a good point from Dr. Abdulmenem. Whenever anyone in the family lost or died for any reason, cancer or stroke or heart attack, try to touch this point immediately. I mean, if the surrogate told you, I have family history of cardiac death or cancer, you can ask, how is this patient now? Is he fine? Is he suffering? Especially first degree. If he lost, you have to give some sympathy and empathy along with the condolences. Okay.
Yes.
And in your scenario, Dr. Sarah, I guess you need some sympathy and empathy to be offered from you. But I think in the exam you will do better because this is online. But in the exam you will feel more sorry than in the online setting.
Yes. All right.
Yes, and don't laugh at the end.
Yes. Okay. No, I'm laughing.
No, yeah, yes,
Only
of
still block.
course. It's okay. You can drive it well. I know since you read the scenario, you are ready to do without preparation that you practice it before. But try to prepare the patient before giving the news. And I'm sorry to share with you this news today. Be sorry always for the feeling, sympathy and empathy. And before organ donation decision and talk, give some preparation by, as I said, help from your mother to others while she's alive, or even if she's alive now, she would help some people. And this is the nature of elderly people, right?
Yeah.
They are helping always. So if you do so, he will just be prepared for the next sentence, which is organ donation.
Okay. You're right. Warning shot.
Yes.
I did
Yes.
it for you, but I did it as Dr. Abdelmenem. I didn't do it. That's why I did it now.
No, you did it after, not before.
Yes.
You did it after, but try to make it before, just to prepare him for the.
Yes, you're right. Okay.
Okay. Yes. Any other comment or any question, Dr. Sarah?
No, thank you.
Dr. Abdulmenem, any question, any comment?
No, thank you.
So both scenarios today are really nice, and they are coming, of course. And be sure the scenarios are repeated from here and there, from center
Yes.
to center. Yeah. So once you practice it once, you will never forget it. So try to make a cocktail
And
of scenarios.
in the post-mortem scenario, when the patient asked about the funeral,
Mhm.
we couldn't give him the death certificate until we finish the post-mortem, right?
No, post-mortem, it's the decision of the medical team, right?
Yes, but if
You mean the coroner? You are talking about the coroner. Coroner, it's
the
the one.
has been taken post-mortem to know the cause of death.
Yes,
So,
it should be done as soon as possible because this is medical process.
yes, but if the patient is saying, as due to religious issue, we need to accelerate the funeral, they
Yes,
didn't have the death certificate until the post-mortem examination is done.
yes, yes, yes. I will provide you, or the medical team will provide you with the death certificate as much as we can, or as soon as we can.
Yes.
In the opposite side, the coroner process, it's not our decision at all. It's
No,
not our process at all. It will be provided by
Mm.
the coroner office, and they will provide it whenever they finish. And it's not optional thing. Yeah, we can do this this scenario in another day.
but you are saying about the coroner, it means that when the patient is requesting a post-mortem, the coroner will take the decision of doing the post-mortem or not, right? You mean that?
Again, when the patient,
Well, when you are talking now about the coroner,
Mhm.
that the coroner, it's mean if the patient is asking, I want to do a post-mortem for my father. So
no, this is different situation. There is two situation in cases for coroners.
yes, can you say
A-
so?
Any fight or I mean police police report
Mm.
accident or fight, someone fight with others, hit any head injury by something heavy, okay,
Mm.
blunt trauma, and he got brain hemorrhage or ICH, and he died after that. Okay, any police case. This is
Mm.
first scenario. The second scenario, any patient admitted for procedure and he died within 24 hours. For example, patient came with MI, shifted to the cath lab, and he died on table.
Mm.
Okay, this is a second. Also, you can add another death on admission after within 24 hours, unexpected one. So patient admitted with seizure, for example, and the the case or the condition deteriorated. He went in coma, and within 24 hours he did. You suspect some recreational drugs or abuse, you can do they will do the coroners. So these are the three situations they are doing coroners in basis: unexpected death within 24 hours, or death on table during surgery or procedure, or the case report, or sorry, police case. Police
Mm.
case like fighting or accident. Okay,
Okay.
these are the coroner cases in basis. Apart from this, it will be post-mortem medical decision. Some patient admitted and he stayed for the long time in the hospital. He had a PE, MI, something is weird. No one knows what happened there, so they can do post-mortem to know about the condition and to learn from it for the researches. I mean, medical
Okay.
research.
Okay.
Okay, this it will be also with consent. The coroner will not be consented. It will be by force.
I see.
Okay.
Okay.
So whenever you have post-mortem, you have to sign consent by family. Whenever you have coroner, tell them we don't have option. It will be done by any way, and we don't have choice to decide for.
Okay. Good point. Thank you so much.
Clear?
Yes, very clear.
Okay, most welcome. Okay, thank you, Dr. Sarah. Thank you, Dr. Arena. Any other question from others?
No.
Okay, thank you all for attending today's meeting. We'll see you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.